Now, a term you hear commonly when people are talking about brain injuries is concussion. And some people refer to concussion as MTBI. Now, of course, we don't encourage abbreviations, but this is a common one, and it stands for mild traumatic brain injury. So the idea here is that the terms concussion and the terms mild traumatic brain injury mean the same thing. So what is concussion? Well, concussion is an altered mental state, with or without loss of consciousness, which occurs as a result of a head injury. So really it's a cover-all term. It's any altered mental state, with or without loss of consciousness, occurring as a result of a head injury. And it's caused by a temporary neuronal dysfunction. So the nerve cells, the neurons have been traumatised and they do not function properly. And the mechanism of action is diffuse brain injury. So the physiological basis of concussion, at least partly, is what we've just looked at in the diffuse axonal injury. And some people actually grade concussion. They'll say that a mild or a grade 1 causes confusion without loss of consciousness, and it resolves within 15 minutes. So grade 1 is less confusion that lasts for less than 15 minutes after a head injury. Grade 2, there's transient confusion, still no loss of consciousness, and concussion symptoms or mental state changes resolve in more than 15 minutes. So grade 1 is less than 15 minutes, grade 2 is more than 15 minutes. And grade 3, there is brief or prolonged loss of consciousness. So concussion can be actually severe. To call it mild is a bit of a misnomer in some ways, because it can cause loss of consciousness. And as we said with the diffuse axonal injury, if the neurons are actually sheared, then unconsciousness can go on for months or even years potentially. So fibre shearing in the area of the midbrain. So remember that here we have the brain stem and the cerebrum above this, and the midbrain being the top of the brain stem and the fibres radiating out from there. So an area where the fibres can be particularly damaged is in the area of the midbrain, where they're stretched and they're sheared. Part of the physiological basis of concussion. Clinically, the patient might be confused, disorientated for time and place and even for person. Headache, of course, is a common feature after any knock to the head, not surprising. Dizziness is a common feature. Inability to concentrate can actually persist for quite some period of time afterwards. Then there can be irritability. These patients can be very agitated for a period of time, always trying to climb out of bed and quite difficult to look after sometimes. They can be nauseated, they can even be vomiting, and memory loss is another common feature after head injury as a result of the concussion. Now, if you're concussed once or twice, that should be okay. But if there's repeated episodes of concussion, then there are cumulative effects on the brain. And this is sometimes called chronic traumatic encephalopathic syndrome. Repeated injury to the brain resulting in accumulative damage. So there can be motor dysfunctions, difficulty moving, reduced power in the muscles, cognitive decline, patients aren't thinking as clearly as they did, and unfortunately Parkinsonian features as well, with rigidity and tremor as a result of repeated concussions. This can be seen in sports people, boxers or people that take part in contact sport. So certainly we want to avoid repeated concussions.